This is my video submission for a bedside physical assessment. So the first thing I would do as a nurse is gather all of my equipment. I would want to make sure that it is clean and it is all properly working. Prior to going into the room, I would make sure that I had a blood pressure cuff, a stethoscope, my watch with a second hand, a pen light, a thermometer, and also there should be gloves, a sink, and hand sanitizer in the room to use throughout my assessment. Next, I would enter the room. The first thing I would do is assess the environment. Assessment begins the second that you walk into the room and upon every interaction with the patient. So I would assess for safety for myself as the nurse and then also for the patient. I would want to note any IV poles, IV pumps, equipment in the room, any wires, IV lines, if the patient has a urinary catheter, any urinary drainage bags, things to that nature. I would also want to make sure that the patient is not in any immediate distress that would require immediate intervention, and that the patient is in a seemingly comfortable position with the bed at the lowest position and the 2 bed rails up. I would wash my hands then, and I would introduce myself to the patient as their nurse. I would then identify my patient using 2 identifiers typically found on the wristband, their name and date of birth. I would then explain to the patient what I am going to do, that I'm going to perform a physical assessment, a head to toe assessment. I also want to note that the choice to wear gloves would be up to me. However, if there's any blood, feces, urine, wounds, skin breakage, I should have gloves on. And the main areas that I should have gloves on regardless are when assessing hair, any areas with those types of things such as urine, feces, or the mouth. So I would then also assess the patient's alertness and orientation. I would note what their level of consciousness was, and in order to assess their orientation, I would ask them 4 questions related to person, place, time, and situation. So again, I would ask them their name, I would ask them where they are, what time of year it is, or what time of day, what month, what season, what year, and for situation, I would ask them who the president is. If they are able to answer all 4 questions, they are considered to be A and O times 4. So alert and oriented times 4. Also, while having this conversation, I am able to pick up on their general hygiene, their grooming, and if there's any odors, their posture, and if they seem anxious or comfortable, things of that nature. The next thing that I would do is measure their vital signs. So I would measure their blood pressure using their brachial pulse as a landmark to place the blood pressure cuff, and I would measure their blood pressure. Then I would also take their heart rate using their radial pulse, their respiratory rate, their temperature orally, if it can be done orally, and I would ask them if they're having any pain, assess a pain level, tell them if they are having any pain throughout the assessment to please let me know, and also measure their pulse ox. After that, I would then record their weight, their height, and if they have any allergies. And then I personally would like to have a face-to-face conversation with the patient about their past medical history, their current medications, and any concerns that they have regarding them, their past surgical history, their family history, and their social history regarding alcohol or drug use. I would also then like to have a brief conversation about why they are in the hospital and if they had any concerns about those types of things. Once that is completed, I can move on to my head to toe assessment. So the first thing I would do, and with gloves on, would be assess the hair and the scalp. And I just want to note that throughout the whole assessment, I will be assessing for hair distribution in various parts of the body, and then also skin. Skin is the biggest organ and it is very important. So I will be assessing skin integrity throughout the whole body. I will be assessing for skin turgor, skin color, any moisture,